Hello everyone, my name is Rohan Tadeli and today we are going to take a look at prescription writing. So first of all, what is a prescription? When a person falls ill, he goes to the doctor. The doctor examines the patient and decides what drugs to give for the treatment. Once the drugs have been decided by the doctor, they need to be written down on a document and that document needs to be conveyed to the pharmacist and the patient. This document is called a prescription. So, by definition, a prescription is a written order by a registered medical practitioner to the pharmacist for compounding and dispensing the required medicine. The word prescription is made up of two parts, pre meaning before and script meaning written. It denotes that this order must be written first before the pharmacist can give the drugs to the patient. Prescription is a legal document. It has medico-legal importance and it can be presented as an evidence in the court of law. Now, in the past, prescriptions used to contain instructions for the pharmacist for compounding and mixing different ingredients such as active ingredients, bases, excipients, vehicles, etc. But nowadays, medications come pre-packaged by the pharmaceutical industry, so the pharmacists do not have to prepare the medicines themselves. The parts of a prescription. Prescription has 5 parts: superscription, inscription, subscription, transcription, and label. Now, superscription. Superscription first of all contains the prescriber's details, such as the name, the qualifications, address, date of writing the prescription, and contact number. The prescriber's details are important for identifying the prescriber. Date is helpful in judging the time interval between writing of the prescription and issuing of the medicines. Next, there are the patient's details: name, age, sex, body weight, address, and contact number. The patient's details are useful for identifying the patient and further handling of the patient in the future. Then there is the diagnosis. The diagnosis may be provisional diagnosis or final diagnosis. Lastly, there is the prescription symbol. The prescription symbol comes from the Latin language, whose meaning is take thou. It denotes that a pharmacist to take the ingredients in the stated quantities and mix them and give the medicine to the patient. Next, there is the inscription. Inscription is also called as the body of the prescription, as it contains the drug information. There is the names of the drug, the dosage form, and the strength of the dose. If more than one dosage form is present, it needs to be written in a specified order. And the order is first of all injections, followed by capsules, tablets, liquid preparations, and finally topical preparations. Now there are a few things to keep in mind while writing inscription. So first of all, write the strength of the doses in SI units. While writing micrograms, avoid the use of the symbol. Instead, write mcg. When writing values less than 1, always write 0 before the decimal point. On the other hand, avoid writing zeros after whole numbers. Avoid using abbreviations in the prescriptions. We cannot expect the patient to interpret the abbreviations correctly. Instead, write full sentences. Now here are a few examples of abbreviations and what you can write instead of that. Now the next part is a subscription. Subscription contains directions for the pharmacist. Now in the past, that is in the compounding type of subscriptions, they used to contain the mode of compounding and the final form of medications. Now in the present times, subscription contains the number of tablets to be given, the number of refills to be given, and whether generic substitution is permitted or not. The next part is a transcription. Transcription contains the dose, the frequency of administration, the duration of the treatment, and the route of administration. Finally, there is the doctor's sign and registration number. Label. Label is a part of the old type of prescription. It does not exist in the present times. Label used to contain the type of mixture, the final form of the medications, the name of the patient, sex, age, address, the address of the pharmacist, and signature. There are some common errors that can occur while writing the prescription. For example, name of the drug is not correct or in illegible handwriting. It may not be recognizable by the pharmacist. To avoid that, we can write the drug names in capital letters, or better, we can use printed prescription formats. Secondly, incomplete prescription. Some things can be missed while writing the prescription. Frequently missed things are address, diagnosis, body weight of the patient, duration of the treatment, and refill instructions. To avoid these, we can use printed forms while writing prescription so that no item is missed, using abbreviated drug names or instructions. The patient may not be able to understand the abbreviations. To avoid these, we should always write full drug names and write full sentences while giving instructions to the patient. Writing drug doses in imprecise units. Avoid using terms such as teaspoons or half cups. Instead, always write doses in SI units. Here is an example of a written prescription. As you can see, there is the doctor's details, patient's details, the diagnosis, and the prescription symbols. Next, there is the inscription containing the drug information, the subscription, the transcription, and finally, there is the doctor's signature and registration number. Here are a few MCQs on the topic we just saw.